Hi, I'm Dr. Stephanie Eakin. I'm the Regional Medical Director for Rogers Behavioral Health.
And I'm Dr. Rachel Leonard. I'm the Clinical Director for Rogers in St. Paul. We're here today to show you how effective and easy it is to access Rogers Connect Care.
Rogers Connect Care is really the same evidence-based treatment that we've been offering in person. The great thing is it's accessible to people of all ages, kids, teens, and adults. You also have the ability to see your entire treatment team. So that could involve a psychiatrist, nurse, therapist, behavioral specialist.
So how was your evening yesterday?
It's really doing the same treatment that you would have in person via video. It's also easy to access. So you can simply click a link in an email that's sent to you to meet with your therapist individually, your psychiatrist, or even join groups as part of your treatment.
We are offering this over a secure HIPAA-compliant platform.
It's also important to have a private space to engage in therapy, particularly during groups, because we want to protect the confidentiality of all of our patients.
To get started, all it takes is a simple phone call. You can complete a free confidential screening over the phone and then get a recommendation for which program would be best for you.
We've also been able to offer virtual admissions for people too, so that you can see the doctor, the nurse, your entire treatment team for your assessments and things that you'll need to be able to be admitted to a program.
A typical day in Rogers Connect Care looks very similar to what it would look like in our clinics. Usually the day starts with a check-in group where you could report what you were working on the previous evening and what your plan is or any needs are for that day. There are group therapy components where a group leader can share content with all of the group members and encourage group discussion. There are individual appointments with a therapist, psychiatrist, nurse, or any other treatment team member that needs to meet with you that day. And then there's some individual time where you would work on very specific assignments geared towards you and your symptoms to help you feel better.
So we'll sit with those feelings together.
In the home setting, there are some advantages to being able to do these assignments from your house or from your room. Individuals with depression often struggle with activities related to keeping their living space neat and tidy, doing laundry, or attending to hygiene. Now, during that individual assignment time, you could work on those things in your home with the support of staff, and they can help you work through any barriers you encounter.
Nice job. That was great.
We also assign exposures for those struggling with anxiety. These are specific assignments that we know will cause some manageable but slightly challenging anxiety levels. And our goal is to help you do those things without avoiding or engaging in problem behaviors. It's not uncommon for some of these things to happen in the home. So surrounding routines in the beginning or end of the day, how people arrange their living space and where they put different items. And now we can work on those things while you're in the home setting, and again, offering that staff support.
What we're going to do is we're going to just sit with that feeling, resist checking, and we'll wait till it goes down in half.
Rogers has long been dedicated to evidence-based treatment. Telehealth has many years of studies behind it in order to support that it can be effective for people, including those with a variety of behavioral health issues. Because it's a new medium for some people, it might feel a little intimidating or as if you can't build rapport with people over a screen. I think a lot of our kids are actually more familiar with it, and so it could be easier for them.
My dad being with me and helping me.
There's also research that for some people with certain backgrounds, perhaps such as trauma, that the virtual platform can actually feel safer for them in the beginning.
And for those who really struggle with being on camera, seeing themselves, hearing themselves, participating virtually, that can actually be a relevant treatment target that could translate into other areas of their lives, especially right now where we're doing many things virtually.
Outcomes are an important part to the treatment at Rogers. Patients complete these at admission and discharge, as well as weekly or every other week as part of their treatment. It helps us individualize your treatment and ensure that you have the best outcomes. This continues as part of Rogers Connect Care.
We're so excited to be offering Rogers Connect Care to make sure that you all have access to mental health treatment during this challenging time.